Hi, I'm Ignacia Fuentes. I'm a scientist, and I'm very excited to be here today to present you our project that we think it's gonna change our children's life. I'll have to apologize in advance because some of the pictures I'm about to show you, they're very hard to watch. However, we believe it's important for you to see them to understand the severity of this disease. This disease is called epidermolysis bullosa, or EB, or also known as butterfly children. And to exemplify the severity, I'm going to tell you about a patient of ours. He has a type of EB called recessive dystrophic EB. And because EB starts since birth, he has been living with this disease for 27 years. Besides his many clinical manifestations, he has around 40% of his body covered with wounds, and now he's also suffering from a very severe and aggressive type of skin cancer that is covering most of his back, and it's extremely painful. We don't want to reach this point. We don't want to reach this point with these patients. We want to go there, treat them earlier as this 6-month-old baby's foot or this 3-year-old little boy's neck. So what is EB? EB is a rare and also considered the most painful disease in children. Around 200 new children are born every year in the United States, but worldwide it's estimated that half a million people live with this disease. Besides being very painful, it's also the life expectancy is reduced. So severe cases can live between months to a few years, or the cases that I showed you before, around 30 years of age. The treatments are mainly palliative care to prevent worse clinical outcome, but as I showed you, that we're by far not there yet. The costs are also very high, and it depends on age, EB type, and country dependent, but in average, a severe case needs around $100,000 a year. All patients have pain, but around 50% of the severe patients have cocoons, hands, and feet, 20% die by sepsis, and 60% because of skin cancer. There are some sophisticated future treatment under development. However, we know they're going to be very costly, and by that, not available to all patients worldwide. So last year, in the middle of the pandemic, we started thinking, what can we do? What's next? What type of treatment we can go to our patients? And we sat down together with our team to think about a simple, easy to implement, and safe treatment to give to our patient. That's how we came up with this compound that is called N-acetylcysteine, or NAC. This is already available in the pharmacy for a very low price, and it's only a slightly modified amino acid. This compound by itself, it's an antioxidant, but it also, when it enters the body, it produces the world's most known antioxidant called glutathione. NAC has been approved by the FDA to treat a couple of disorders since many years. And these last years, more and more data has been showing the potential to improve wound healing, and also last year in EB. So the effect will be mainly antioxidant, and that will help with impaired inflammation, decrease fibrosis, and endothelial dysfunction, all of which are present in EB wounds. So knowing this, we thought about we're going to have a partially new use for a new disease and a new administration route in this case that is topical. Our trial will be a single-site, open-label, prospective control study, hopefully to start at the end of this year. We're going to recruit 8 RDB patients between the ages of 2 and 18 years old. And although this is a rare disease, our nonprofit also only sees EB patients, and this is only 1/3 of the patients that we see. We're going to follow patients for 28 days, and there are going to be 2 wounds per patient. Wounds have to be larger than 21 days and larger than 10 square centimeters. But for anybody that has ever met an EB patient, they will know this is not a criteria difficult to meet. Half of the wound will be treated with NAC and the other half with placebo. And this is very important because each wound will be a control on themselves. Specifically for EB patient, which wounds move, this is important to have a good control. On top of them, the patient will be used as the primary dressing. The trial will be of 4 weeks, and they will come 5 times to the center to evaluate different parameters for safety and efficacy. But we have also included home visits here in green, in which a nurse from our team will go to the patient's house to ensure that the treatment is applied at every dressing change. Currently, we have the RRB approval is in process, but the team and all the in vitro antioxidant assessment are already in place. The budget for this trial completely is $50,000, and this is unique for a trial like this because of the number of patients and what it involves. However, and it's important for you to know this, that this is only possible because NAC is such a cheap and easy to access compound. Our team is composed by very knowledgeable and experts in the field from Chile and South and USA, clinicians and scientists. We have been working together for many, many years, and in EB with and for patient, and which is key to ensure the success of this trial. Finally, we believe our trial will have a huge impact on EB patients because there's an urgent need now to get a better, safe, cheap, and easy options to treat these patients. Our study will be a proof of concept trial to generate enough data for off-label use of N-acetylcysteine, or enough data also to generate larger clinical trials. In summary, our trial will reduce wound healing time, either by fibrosis or inflammation or both. And that will certainly translate into decreasing the cost of medical care, decreasing the cost of wound dressings, decreasing pain and possibly itch on patients. But most importantly, it will improve patient quality of life because we need to change the life of our children now. Thank you. Thank you for your attention.